Director of Events and Emergency Management, and I'll ask him to introduce himself in a moment. If you are watching this live, there should be a link to be able to answer questions on the webpage. We anticipate this panel lasting about a half an hour. We'll get to as many questions as we can this morning, but please also continue to consult colorado.edu/coronavirus for updates. I also want to extend a thank you to our faculty, students, and staff who are all making sacrifices to uphold the mission of the university as we respond to this global pandemic together. We had originally planned this town hall to answer questions focusing on issues important to students, faculty, and staff as they navigate classes and living situations. We will still answer those questions either in our FAQ or in a forthcoming virtual town hall. But in light of the news yesterday that we have our first presumptive positive COVID-19 case on campus, we knew you probably would have more pressing questions about that. Yesterday afternoon, we learned that a CU Boulder employee did test positive for COVID-19. We are cooperating with Boulder County Public Health, which is investigating further details, including the risk of exposure. What we know this morning, we are continuing to work with Boulder County Public Health, who will be contacting individuals who have been in contact with this employee and asking them to stay home for 14 days and monitor their health per CDC guidelines. The employee did not work in dining. The employee did not eat in the dining halls on Monday. Dining has started cleaning protocols last night, and they've completed those to make sure they are ready for breakfast this morning in the dining halls. We also started cleaning the C4C office and common areas last night. Cleaning will continue throughout each office over the weekend if necessary. We are already following public health guidance regarding additional cleaning and sanitization steps to prevent further spread of the virus. In anticipation of a positive COVID-19 case on campus, our campus began to transition to remote learning and remote working earlier this week. By moving to remote learning and remote work, we believe these actions will substantially reduce the number of contacts per day by students and employees and allow us to minimize the spread of the virus and reduce impact to health services on campus and in the county. For many students, this is their home. They are supported here, learn here, and this is where they have access to critical services. For this reason, and based on the current information available, we do not believe closing campus is warranted. We are continuing to monitor this evolving situation and will take additional actions to protect the health and safety of our community as necessary. For the latest information, we do urge you to continue to check www.colorado.edu/coronavirus. With that, I'll turn it over to Garry.
Good morning. My name is Garry DeJong. I am the emergency manager for CU Boulder. It is my role to minimize the campus's vulnerability to hazards.
So with that, I'll open it up to questions. We don't anticipate we'll get to everyone's question today, but we will be adding continuing to add answers on colorado.edu/coronavirus. And we continue to encourage you to check there regularly. So first we'll go to some of the questions that were submitted in advance. We're doing everything we can to promote the campus health and safety while still upholding the university's mission. Most importantly, for many students, again, this is their home. They are supported here, learn here, and need to continue to have access to critical support. I'll put this next question to Garry. How will the security of buildings be ensured? With fewer people in and out of buildings to oversee occupants who should not have access, and have we considered restricting access to card swipes?
Excellent. We are aware of this issue. As the campus transitions to having fewer employees, staff, and students on campus, we continue to adjust those access capabilities. We are working with our communications people to communicate out and to post updates to building access protocols. Certainly, we urge everyone to visit our website, colorado.edu/coronavirus.
I'll take this next question. What would trigger a full campus closure? We continue to monitor the changing situation and guidance from the Centers for Disease Control and the state of Colorado. Our primary goal is to continue to promote social distancing. Another question. How are you protecting people who are still on campus, such as facilities management and cleaning staff? Our staff are trained in the best practices for cleaning and disinfecting work areas. We also recommend people follow CDC guidance, such as washing your hands frequently and not touching your face. What do I do about childcare given K through 12's closures? In light of the announcement last night from BVSD and other school districts that they are discontinuing or suspending classes, we want to provide guidance to supervisors and employees who need to be home with their children. Supervisors should be flexible with their employees who have school-aged children and allow them to work from home tomorrow as needed in the near future. For those who have been given direction to work from home, please continue to do so as possible. For those whose work must occur on campus, we will continue to provide guidance to supervisors as the situation adjusts. Let's go ahead and go to some of the live questions. Did this person work as a cook in the dining center at C4C? The employee did not work in dining. The employee did not eat in the dining hall as well. We have started to increase cleaning through the building last night. Gary, what is the process for informing people who might have been exposed to someone who later tests positive?
Certainly. We have a process for broad notification through our rave alert system should we have a large-scale exposure. However, for the people who were in contact with this positive patient, the Boulder County Public Health is going through a process to identify those people and making contact with them.
Another question for Gary. Can you curtail St. Patrick's Day gatherings?
Currently, CU Boulder is limiting the events that we are hosting here on campus. The St. Patrick's Day gathering is something that does not take place here, so we are supporting the city and the county of Boulder in the guidance that they have provided and trying to maintain social distancing and not having large gatherings.
Are you adding additional staff and resources to support remote instruction? Yes, the university has provided additional technical support and continue to monitor IT systems to make sure that they will be in a position to support remote learning. We know that there are additional questions that have been received that are very specific about instruction, and we will be working to post those at colorado.edu/coronavirus. Gary, what are our plans for commencement?
Commencement is a very important event for CU Boulder. We're well aware of this. We have ongoing meetings and discussions of what our plans will be for commencement this year. We are hoping to have that decision and guidance out by the end of next week.
Do you think staff will be asked to work remote? Do you think staff will be asked to work remotely for the rest of the semester as well? We don't know for sure. We are preparing for employees who can work remotely to do so for the remainder of the year, however. Next question. What is the direction for student employees who have roles or function that cannot be performed remotely? Are they to report in person? We are working on a transition model and information will be forthcoming. Any employee who can work remotely should do so by Monday if they haven't started that already. Garry, can and will research continue?
Absolutely. Our research programs are very important for CU Boulder. They have some very different scheduling dynamics and needs, and we continue to work with our research programs in identifying ways to make sure they have the access and the support they need to maintain their research programs.
Thank you. I'll go back to some of the prior questions that were submitted. When will the campus return to normal operations? We have said we moved to we have moved to online teaching for the rest of the semester. We are continuing to work with local and state health officials to monitor the situation and hope to return to normal operations as safely as possible. What could trigger a full campus closure? Again, we'll continue to monitor and consult with both the state and local health officials, and our goal is to, right now, continue to do what we can to promote social distancing while still supporting the students who are on, who need to be on campus. Another question, will there be study abroad in the fall? I think it's too early to make that decision. That the Education Abroad program is continuing to monitor the situation, obviously abroad, and will make the decision based on CDC guidance. Will you provide tuition refunds? The campus is continuing to determine what types of plans we need to have in terms of as the situation evolves, and this is something we'll have additional information on in the future. Let's see. Will CU's network crash if everyone is online and taking classes at the same time? We have been reviewing our systems to ensure that we have that we have the infrastructure in place to support this transition. If needs of greater capacity arise, we will work to address that. It's also important to recognize that many of our services are internet-based, and the technical issues that may come up may be outside of our control, maybe remotely, and for example, in someone's individual computer. People can contact the help, our IT help, for additional assistance. Who gets an exception for the new travel requirements? It really depends on the reason for the travel, the location, and whether that region has COVID-19 cases. We're evaluating those on a case-by-case basis based on the specific circumstance. Will there be coronavirus testing available on our campus? We are presently screening all patients who enter our health clinic for COVID-19 symptoms and their travel history. We are only providing testing for those individuals who have symptoms that align with the guidance from the CDC. It's important to remember that the state still has limited capacity for testing. So this is the reason why we need to make sure we're limiting testing to just those who have symptoms.
Just wanted to add that the testing is focused for our student population, and it's not for faculty staff. They would still be going through their normal primary care practitioner to be evaluated either by phone or an actual office visit and follow the direction of their primary care practitioner.
Okay. Question for Garry. Can I leave Can I leave my personal belongings in my room? Plan to move virtual from patients' home and then come collect my stuff later?
Absolutely. We're monitoring what several universities around the country are doing, and they are setting separate dates for people to come back, and those are like pre-scheduled employments. appointments rather, similar to what we did for move-in. That way we're not having large mass numbers of people coming at one time, or we can coordinate having items shipped back to them. Those discussions are underway. We've not yet finalized that model, but we are working on how we can best facilitate that for the students.
Other universities have shut down their dorms and allowed students who have special circumstances to apply for a waiver to stay in them. Why not follow that course of action? Different universities have different situations based in their communities. We continue to monitor that, and it's important to understand that we will continue to adapt our response as the situation changes. If a student wants to move out, do their meal swipes expire, or can I donate them to swipe it forward? It's an excellent question. I'll take that forward, and we will work to get an answer to that online. Garry, how will you handle students returning from spring break?
Certainly we know our students take the opportunity to go out and go to different places, whether it be home or going on vacation. What we're asking them to do is to monitor themselves and let us know where they are returning from, realizing if there is international travel that is still taking place, some of those countries may require you to have a 14-day self-isolation period for you to make sure that you do not develop any of these signs and symptoms before returning back. So you may be asked to self-quarantine or self-isolate, realizing that we do have all of our learning going remote, so you should still be able to continue your academic coursework without any impacts there.
Another question for you, Garry. How are students being supported in managing the stress, anxiety, fear, and possible mental health issues related to COVID-19?
The campus has several programs to access, whether it be through CAPS, through the through Residence Life. We encourage people to reach out and seek any advisement that they need, because certainly we all handle stress differently, and on top of normal course loads, we don't want students being overburdened by this. So we encourage them to reach out and talk with somebody, find the appropriate platform for them, and get the assistance that they might need.
Another question, now that you've canceled in-person classes, students are just going to party. Shouldn't students go home and finish their classes in the safety of their own home in a more controlled environment and to help limit the spread of virus in our community? Certainly, individual students who feel that the best place for them to continue their studies can certainly go to wherever that location is. It's also important to recognize that for those students in the residence halls, there are additional steps that are being taken to ensure their protection, including providing additional sanitization and cleaning, and additional guidance to keep that guidance in the forefront of their mind. For Garry, how do we best protect each other and workers while at the grocery store, deliveries, and yes, restaurant, bars, and pubs?
That's a great question. The guidance is from CDC is to avoid large gatherings. Certainly with social distancing, as people have, as you research and you may have heard, they recommend a 6-foot space. Realizing just by walking by somebody, you are probably not at risk. Certainly, we are asking anybody, if you think you have symptoms that may be related to whether it's COVID-19, the flu, or any other cold, to not go out into public. Certainly that would help this. But if you feel you've been exposed, or after you've been out in the public, certainly follow the hygiene recommendations. Wash your hands, wash your face, maybe change of clothes if you've been out there, just to reduce that exposure that may have occurred.
Another question. How are you dealing with dorms and out-of-state students? Do students need to stay in Boulder, or can we bring them home? I think this is a good reminder as to why it's important that the campus needs to continue to maintain operations, because this is their home for many of our students, and they need to continue to have support on campus. Again, if individual students feel the best place for them to continue their studies is at home or some other location, they should go ahead and take whatever actions they feel are necessary. While classes are online, are permits null? I'm guessing this is parking permits. I will go ahead and we'll take that question and follow up online to get the answer for that. For Garry, since the buildings remain open but will have far fewer people in them, what additional security steps will we be taking to ensure the security of anyone who in our community who must still come to work, such as proctors, library staff?
Excellent. And certainly this ties into the we had earlier in the program, and we continually monitor what those population loads are going to be. So we will manage that with our access protocols, but we are also adjusting work schedules for our community safety officials as they go around and assist with locks and unlocks. We're managing their time for both meeting campus needs as far as having access to our buildings, but also being prudent in reducing their exposure here on campus as well. So we're working to manage that from both perspectives.
Okay, thank you. We have a question of what will it take to close campus. I think it's important for people to remember that the actions that we're taking are a continuum as we continue to adjust our plans and actions to protect the campus. It can be, there are many services and types of things that need to continue on campus, and so the concept of closing campus can be as challenging as, say, closing a city. Why not hold finals early and finish the semester early? I think it's important, we have an obligation both to our students and as part of accreditation to continue to ensure that students get meaningful education and meet the educational objectives for their courses. And that's why we're continuing to encourage remote learning. What about real-life engineering labs or senior design or research projects that cannot be done online? Individual faculty will be working with their departments to answer these types of questions. We recognize I don't have all of the answers in terms of how faculty will implement those changes, but we're encouraging faculty to work with their department. Can you please transcribe this town hall and post it online? Absolutely, that is part of the plan. For Garry, can you describe what is being done in C4C?
Certainly. Last evening, as Dan mentioned in the opening, they started doing a cleaning in the area where we felt the patient was in contact with people. They're using disinfecting procedures as outlined by the CDC. It's important to note that it's not just there that's occurring. We followed up there specifically, but our cleaning services staff has started using these processes and these guidance for all of their cleaning practices. So we have really increased the cleaning processes throughout the campus, and then when we have an exposure such as this, we pay additional focus on that area to make sure it is safe for both students and employees.
Thank you. If you do close campus, how will you schedule things so as to minimize human contact? Can you answer that?
Well, we will certainly follow social distancing guidelines. As we close, if we were to close campus, certainly there would be a significant reduction in contact with other people. There are certain activities that just need to be done either in an office setting or in a face-to-face situation. And we certainly recommend people, number one, if they are sick, do not show up for that. And then number two, to maintain personal space, the social distancing, 6 feet, try and minimize the length of that interaction, and then to follow good hygiene after that.
Another question for Garry. Aren't the residence halls the most likely place for the virus to spread? We should close them down.
Certainly the residence halls are an area where we have a congregation of a lot of people, but it's certainly not the only location on campus where that is taking place. We've been focusing on maintaining a good, clean environment for our students who are in the residence halls. We've asked them for their help in support of maintaining social distancing, using good hygiene. Right now, the campus is maintaining and keeping the residence halls open, but certainly we're monitoring this fluid situation, and we'll make adjustments as appropriate from CU leadership.
Thank you. Another question for you, Garry. Are you providing supplies like hand sanitizer or cleaning wipes since all the stores are out?
We're in the same situation where we're having challenges with the supply chain issue as well. We are certainly focusing on trying to provide the basic needs for everyone, but as this progresses, as you've seen on the media, when you see the shots of Costco or any of the grocery stores or things of that nature, there is a run on all these cleaning supplies. And certainly we are impacted by those as well. So we are doing our best to provide those resources to the campus and the campus community, and we'll do our best, realizing that that is a challenge. We ask people to use them and use them judiciously. However, we've also had some instances where those resources are taken to other locations or off campus, and we just ask people to be respectful of those resources, and those are the activities that we're taking place right now.
Thank you. For Garry, what will happen for PhD or MS students who rely on lab access if it comes to the point that all buildings must close?
Certainly that's a combined question of access control as well as back to the academic process of what is being required by their academic advisors or professors, and they need to work individually with those because, as Daniel alluded to earlier, there's accreditation standards that need to be met, and there are other intricacies there that we're just not aware of, and they need to work closely with their professors and advisors.
And I'll add that CDC guidelines have been clear that while they're encouraging universities to move to remote teaching, that does not preclude faculty,
correct,
for example, in coming into their office and working from there. You can do that and still maintain social distancing. Can you please explain the employee guidelines again? So to make it simple, today, employees who can work from home should continue to do so. If you've been asked by your supervisor to come into work, please do so that you can continue to support campus operations that are needed for for both our employees and especially for our students. For Garry, will the rec center close?
Each individual facility is discussed on a case-by-case basis. We will certainly work with the rec center and see what the needs are for their hours and with the student population that is on campus. Certainly we've encouraged them to up their game in regards to the cleaning process, just like any other facility. So we're trying to maintain that the facilities that are open are safe for people to go into, and we want them to know that it is safe, and we encourage people to use the facilities until we have to make changes to the campus operations.
Okay. We will have to leave it here for today. Again, we'll make every effort to update the FAQ online with additional questions that we may not have been able to answer today. We will encourage you to continue to check www.colorado.edu/coronavirus. That site is changing daily. Thank you all for watching this virtual town hall, and thank you all for the questions. I also want to express my gratitude to all of CU Boulder's faculty, staff, and students. We recognize that mitigating the spread of the coronavirus will require significant work, flexibility, and creativity from our community. I'm Dan Jones. Thank you for watching today.